Chairman, I'm going to get a chainsaw to get the arms on these chairs off over here. It's getting harder and harder for me to get in.
I hear you.
I apologize.
No, thank you.
Secretary, thank you very much. Madam Secretary, thank you very much for your appearance today. As former governor of Kansas, I have a question for you. It's not a loaded question. It's a question of great concern around the country in various states. In the Affordable Care Act, there's an opportunity for states to expand Medicaid eligibility. And in that, there is a promise for the feds to make hold harmless the states for a period of time, but not forever. In 1978, in the Carter administration, when we passed IDEA for handicapped children, there was a 40% federal mandate of increased money flowing to underprivileged children and disabled children, with a promise that the feds would fund their fair share. But in all the years since 1978, the feds have not, and the cost of education in the states has gone a lot higher. As a former governor, do you fear at the end of the hold harmless period on the Medicaid expansion, states that have taken it will be burdened with the amount of money they cannot afford to pay on Medicaid?
Well, I certainly was the recipient of the IDEA promise that was never fulfilled, so I watched that very carefully. I could tell you that at least for the decade that ACA is funded and in place, the funds are there to, in fact, fully expand Medicaid for all the states, which is what was anticipated when the law was passed. I don't know the window beyond that 10 years, but I can tell you that funding is there. It's part of the law. It's part of, so unless pieces of that funding are repealed along the way or Congress decides to change the law, that will be done.
Second question. I was one of 8 Republicans who met for a series of 8 weeks with Dennis McDonough and on 2 occasions with the President in an ad hoc fashion, if you will, to try and find some common ground on deficit and debt reduction. One of the top, and this was last year, in dealing with last year's recommendations by the President. And in his recommendations were significant cuts in terms of Medicare to help reduce the growth rate of the debt and the deficit. One of those was change CPI, which at the time in the budget last year was included by the President, which has not been included this year. Does that indicate a reduction in the interest in the administration to find ways to reform entitlements so without cutting people's ability to get those entitlements, we manage them on a basis that makes sense for the future?
Senator, I would say that the President still is very interested in the possibility of some global approach to deficit reduction and revenue enhancement, but he has said, I think from the very beginning, and I assume he said it inside the room where you were, that he feels a balanced approach is very important, and I think there are a whole series of ideas that he put forward as part of that balanced approach where in some cases cuts are made and in other cases revenue is raised. But in that context, which did not go forward, as you know, I don't think it's a lack of interest. He'd be eager to engage in that discussion again, but not make cuts where there isn't a balanced approach.
Well, the actuarial clock is ticking on our country in terms of debt and deficit, and all of us in both parties are going to have to sit around a table and talk about some very difficult discussions, and one of those are going to have to be reforms to entitlements. I personally think calling it Social Security and Medicare an entitlement is a little bit wrong, because I've paid 1.35% of my income for Medicare since 1968 and 6.2% of my income for FICA taxes for Social Security. People should expect them, but if we continue to promise more than we can deliver and don't reform the system, one day the game's going to be up and the American people are going to be left holding the bag, and I don't want to be a part of that. So I hope you and and your department has probably more to do with the rate of growth, not because of anything you're doing, but just because of the demands of health care, Medicare, and Medicaid, of debt and deficit, of any other single thing whatsoever. So I look forward to working together with you and the administration in the years ahead to try and find some way to find common ground so we can begin to do that.
Well, I would very much look forward to that opportunity, and I think circling back to Chairman Wyden's point and the beginning of this discussion, I think that there was an enormous amount of entitlement reform in the Affordable Care Act around Medicare, and it's working. It is working in a way that was difficult to predict at that point, but is happening, and I think that it is continuing on into the future, and I think the recent prediction of the actuary, if we could just keep Medicare spending at the rate that we've seen the last couple of years, we would have an enormous change in the overall cost growth. So I think there are some features in place, some ways to shift from a volume payment to a value payment, some different forms, as the chairman referred to, the delivery system reform that are beginning to show very promising results. So I think that we would very much look forward to talking about a structural change that really is on the delivery system payment side and keeps benefits in place for seniors.
Well, I agree with that comment. I just don't want us to substitute provider cuts for reform. We could reach the point where you can cut too far, and then it's not reform, it's disastrous for the program. Thank you very much.